How do lymphoma prognostic factors impact treatment choices? Imagine your doctor is trying to figure out the best way to fight lymphoma. They look at many different clues about your health and the disease itself. These clues are called prognostic factors, and they help predict how the disease might behave and how well you might respond to treatment. Understanding these factors is key to choosing the right treatment plan. One of the most important factors is age. Younger patients, usually under 60, tend to handle aggressive treatments better and often have higher chances of recovery. Older patients might have other health issues or a weaker immune system, which can limit treatment options and influence how the disease progresses. Performance status is another crucial factor. This measures how well you can do daily activities, often using a scale called the Eastern Cooperative Oncology Group score. If you are active and able to care for yourself, you are more likely to tolerate intensive treatments and have better outcomes. The stage of lymphoma also plays a big role. This refers to how far the disease has spread. If it is localized to one area, less aggressive or localized treatments might be enough. But if the disease has spread widely, more aggressive systemic chemotherapy is usually needed. When lymphoma spreads beyond the lymph nodes to organs like the liver, bone marrow, or brain, it becomes more complicated to treat. This extranodal involvement often indicates a more serious prognosis and may require targeted or intensive therapies. Lactate dehydrogenase levels, or LDH, are another marker. High LDH levels suggest a larger tumor burden or more aggressive disease. This often leads doctors to consider stronger or combination treatments to better control the disease. How your disease responds early on also matters. If the lymphoma relapses or progresses within 1 to 2 years after initial treatment, it usually indicates a poorer outlook. These patients might need more aggressive or alternative therapies to try to keep the disease in check. Genetic and molecular markers are increasingly important too. Different subtypes of lymphoma, based on genetic profiles, can respond differently to treatments. For example, some genetic patterns may be more likely to respond to certain targeted therapies, allowing for more personalized treatment plans. Doctors often use tools like the International Prognostic Index, which combines many of these factors to classify patients into different risk groups. This helps them decide how intense the treatment should be, balancing the chance of controlling the disease with potential side effects. For example, a young person with early-stage lymphoma, good performance status, no spread beyond the lymph nodes, and normal LDH levels might receive standard chemotherapy aimed at curing the disease. Meanwhile, an older person with advanced disease, poor health, and high LDH might get a modified, less intense treatment to reduce side effects while still aiming to control the lymphoma. Emerging technologies like PET scans, minimal residual disease detection, and circulating tumor DNA testing are helping doctors get a clearer picture of prognosis. These tools may soon help refine treatment choices even further, tailoring therapy to each individual's disease. In the end, understanding these prognostic factors helps doctors make smarter decisions about treatment. It allows them to personalize therapy based on how the disease is likely to behave and how well a patient can tolerate different options. Always remember, each person is unique, and treatment plans should be discussed with your healthcare team to find the best approach for you. If you or someone you know is facing lymphoma, consult with medical professionals for advice tailored to your specific situation.